Bismillah ar-Rahman ar-Rahim. Investigations in lung abscess. Investigations for lung abscess include the following: the radiology, the radiology part of investigation, which include doing a chest X-ray. There is a specific finding, which is a dense shadow is the initial finding before rupture. Then cavity with fluid level. The wall is thin in acute abscess, and the wall is thick in chronic lung abscess. Radiological signs of complications such as pneumonia, pleural effusion. The trachea shifted to the same side in case of fibrosis when there is chronic abscess. The CT chest will confirm the diagnosis also of the the cavity with fluid level. And as we said before, the wall is thin in acute acute abscess, and thick in chronic. And may reveal the underlying cause of abscess if there is obstruction of trachea due to tumor and so on. Sputum examination. For sputum examination, we do culture and sensitivity and microscopic analysis to determine if infection originates in the upper airways or lower airways. The bronchoscopy in lung abscess has diagnostic rule and therapeutic rule. The diagnostic rule is to exclude malignancy and foreign body, and therapeutic rule of bronchoscopy in lung abscess to do aspiration of secretions and instillation of antibiotics and removal of the foreign body. That's to say, foreign body extraction. Then the blood examination in lung abscess may reveal leukocytosis, increased white blood cells, and increased leukocytosis or presence of leukocytosis. Sometimes there is anemia. The differential diagnosis for other cause of cavitary or suppurative syndrome, as for example, infected cystic lung or empyema with bronchopleural fistula and bronchiectasis. The treatment of lung abscess. There is prophylactic management for lung abscess, such as treatment of pneumonia or other chest infections as early as possible. If the patient is in the hospital, should do measures for avoidance of formation of lung abscess, such as keeping the head of the bed 45 raised 45 degrees. The therapeutic management of lung abscess include a medical part and surgical part and the diet. The medical part, the main line of treatment include antibiotics, usually combined antibiotics to cover gram-positive and gram-negatives, in addition to treatment of anaerobes, penicillin G or third generation cephalosporin to affect gram-positive organisms, aminoglycosides to affect gram-negative organisms, metronidazole to affect anaerobic organisms, if that coming from the intestinal part, and clindamycin if the organism suspected to be coming from the airways or the mouth or oral cavity. The postural drainage, very important in management of lung abscess. The bronchoscopy, as we said before, has a therapeutic role. such as aspiration of secretions, instillation of antibiotic, and foreign body removal. The symptomatic treatments include hemostatic drugs in case of hemoptysis, analgesics for pain, expectorant, treatment of complication. The diet, good nutrition with high protein diet is advised in case of lung abscess. The surgical part um, usually indicated in severe hemoptysis, failed medical treatment, and chronic lung abscess.